Good morning, everyone, and welcome back to another day for EDUSA Week 4.0. Today is Friday, and today is dedicated to Health Talk. We have health personnels in the building. They will share their expertise, and I believe from here we will all learn something from them, and then when we go, we try to practice it. Health is wealth, and health is everything. If you have health, you can achieve anything that you want. So before we go into the program schedule, I would like us to pray in our own individual way. Then from there, we can start the program. I am Sheikh Omar Fati, Information and Communication Minister of the 15th Executive Council, Education Student Association, University of the Gambia. Now to the high table. On my immediate left, we have Honorable Dembo Jobate, Technical and Logistic Minister, 15th Executive Council. Can you put your hands together for Dembo? Next to him, we have Fatou A. Toure, Gender and Health Minister, 15th Executive Council. Now to the guest, we have Mr. Seni Jabi, midwife at Sanyang Hospital. And from there, we have Mr. Bakari Ndao, our own lecturer at the University of the Gambia. Today is a good day, Friday, and it's a day that we are going to learn a lot. Now to the program guide. Mr. Seni is going to talk about sexual transmitted infection, disease, and reproductive health issue. Mr. Bakari Ndao is going to talk about mental morality, prevention, causes, and possible solutions. And also, we will have Honorable Minister for Health to give us the opening remark, and the closing remark is going to be given by the Deputy Elizabeth Shayo. So these are our program guide for today. Call the Honorable Minister to come and give the opening remark. Honorable, the mic is yours.
Good morning, everyone. Like he said, my name is Fatou Eture, the Gender and Health Minister for the 15th Executive Council, EDUSA, School of Education. First, I welcome all of you to this annual Health Day that we always organize during the EDUSA week. Today, we come here together as EDUSANs to explore the importance of physical, mental, and our emotional well-being. Our goal is to empower each other with knowledge, resources, and support each other toward a healthier life. Throughout the day, you will have the opportunity to be educated and interact and engage with experts who are passionate with health. We believe with the themes today, we will definitely enlighten you and be caution of our lives. Let's make today a step towards a healthier future for ourselves and each other. There is a proverb that says, the way to keep your health is to eat what you don't want, drink what you don't like, and do what you rather like it. Thank you for being here today. And let's get the program started. And I hope you will all enjoy and listen keenly from our expertise, our health personnel, which is Mr. Bakar Dao and Mr. Seni Jabi, today to present to us what they have for us. Therefore, I welcome all of you once again, and I'm saying I'm pleased to have you all here to grace this occasion, which is the Health Day. Thank you.
You, Honorable Minister for Gender and Health, Minister 15 Executive Council. Prevention is better than cure. I can fully remember Professor Ensa Ture told me in the Gambia, our problem is the food that we take. That is our problem. So we need to control our diet and then so that we will be healthy. The food that we take, we should be very, very cautious about it. Now, let's invite our first speaker to come on board, and please join me and welcome Mr. Bakarin Dao, lecturer at the University of the Gambia, to come and share whatever he have for us.
My name is Mr. Bakarindaw. I'm a lecturer under the Department of Public Health. My task today is to talk to you on maternal mortality, the causes, prevention, and possible solutions. So it's somehow easy but a little bit difficult because you don't have a health background. But I will try as much as possible to be able to at least explain some terminologies for you to understand. Okay? This is going to be my presentation outline. We're going to talk to you a little bit of background, what we need to understand about maternal mortality. Then we will look at the major causes of maternal mortality and morbidity. And we have to put it into context, why most of the mortalities we are receiving as a result of what we call some trade delays. In general, we're also going to talk about the major risk factors to maternal mortality and what can be done in terms of some of the interventions that are done to be able to bring down those deaths. And I'm informed that mainly we are all educationists. If we are teachers, yes, what can be our role in trying to bring down maternal mortality? Okay, the first question arises to say, what is maternal mortality in the first place? Now, according to WHO, it is annually, on yearly basis, the number of females who die, which is related to pregnancy or its management during the pregnancy itself or during childbirth, and soon after, which we call the postpartum period. Usually, it is 6 weeks, and that's 42 days after the termination of the pregnancy. So the question now arises, should someone actually die when we are bringing new life to earth? Okay. As of April 7, 2025, WHO has reported that in 2023, over 700 women usually die from preventable causes of pregnancy and childbirth-related deaths on daily basis. And almost every 2 minutes, someone dies as a result of pregnancy or childbirth-related issues. And between, although there is progress, of recent we have seen a lot of, particularly in the Gambia, a lot of, I would put it as misinformation, that maternal mortality is on the rise. But globally, it has been observed that there is drastic reduction, up to 40% worldwide. But we'll see what is happening around the world. 90% of all those deaths that are still occurring globally are occurring in low and middle income countries. So Gambia being not an exception. Now, there's also, I would put it as misunderstanding. When we say maternal deaths, there is something that is also wrongly interpreted. There's what is known as maternal mortality ratio. And what is this maternal mortality ratio? It refers to the number of maternal deaths to a particular section of the population. That is about every 100,000 live births. Women who give birth, and out of the total from 100,000, the number that dies. And that number is what is usually, because if you have 100 deaths in the Gambia and we have 1,000 deaths in Nigeria, how would you quantify them? It has to be on a ratio. You have over 100,000 people in Nigeria and you have just over 2 million people in the Gambia. So you wouldn't be able to quantify in terms of reality what's the magnitude or the burden of the problem. So to put that into context, that's why the ratio is calculated. So in the Gambia, our latest national survey, which is the Gambia Demographic and Health Survey, which was conducted in 2019-2020, estimated that the maternal mortality ratio has now dropped to about 289 per 100,000. Okay, and it is estimated that specifically looking at deaths which are actually related to pregnancy, we call pregnancy-related mortality ratio. For the 7 years prior to that survey, was that it was 320. So we can see there's some efforts done to reduce the maternal mortality ratio. From that survey again, it has been reported that about 17% of all women who died are related to pregnancies and childbirth. Now, again, we looked at, there's an international agency comprising of several stakeholders, the WHO, UNICEF, United Nations Fund for Population Affairs, and other interested groups, which together looked at the maternal mortality ratio from 2000 to 2023 as reported by countries. And we have seen a drastic reduction from 810 in 2000 to about plus 354 in 2023. But the actual precisely talking about maternal related deaths from pregnancy is these figures. In 2023 is about 14%. WHO and our survey in 2019 indicated 17%, but in 2023 is about 14%. The actual deaths which are actually reported, we have also seen a reduction in 2000 from 484 to just 291 in 2023. Okay, we also looked at our own data. That is the data coming from our service sector. Our health facilities are also reporting on maternal deaths. Looking at the trends from 2019 through to 2023, although there is a slight rise in the number of reported deaths at our health facilities. But if you put them together, there are some that are also brought in as death. You cannot do anything. And there are others who arrive, upon arrival, they die. So putting all of those together in 2023, although the previous, we looked at that sectoral collaboration internationally, looking at the estimates from the country, reported that it was over 300 plus. But what is actually reported in our own database from the Health Information System of the Ministry of Health is about 147. Although others can occur in the community that we are not aware of, but what is reported in our health facilities is about 147. Now, to the main topic, what are the causes? Now, there are those causes which are actually directly linked to pregnancy and pregnancy outcomes, which we call obstetric deaths. And these are mainly from what we call hemorrhage, which is bleeding of all forms, including before the woman goes into labor, antepartum hemorrhage, and shortly after delivery, postpartum hemorrhage. But again, too, there are other deaths which are related to abortions and or obstetric emergencies, called one of which is ectopic pregnancies. That is pregnancy out of the uterus. We don't want to go into detail to explain all of this, but there are other pregnancies. If there is fertilization of the ova, it is supposed to descend into the uterus. So in the event that did not happen, and the fetus tried to grow out of the uterus, it becomes an emergency, and then that can lead to bleeding, and the individual can die from it. Unsafe abortions are also done, because we will see later in the presentation, some people have some pregnancies that they don't plan to have, and in an effort to actually abort such, they may end up having bleeding and they can die from it. Okay, we also have hypertensive disorders. This may include preeclampsia and eclampsia. These are conditions that the pregnant woman will have as a result of a rise in the blood pressure, and which have impact on the pregnancy and also the life of the mother herself. There are definitive signs that actually indicate that the woman has these conditions, but they are related to hypertension. Again, also during the process of birth, there could be obstructions, okay? And that can also lead to bleeding, and the woman can die from it. And in some instances, because the woman may not have enough energy to push the baby out, efforts may be made, whether traditionally or conventionally, to help the woman give birth. And in that process, particularly if the woman has high parity, a lot of pregnancies, that can lead to the rupture of the uterus, and that can also cause death. Again, infections. A lot of infections that can actually affect the woman, but also it can descend or ascend from the birth canal into the uterus, and also affect the fallopian tubes or the urinary system. All of these things can also lead to death, not only for the mother, but also for the unborn child. We have what we call indirect causes of death, major among which is nutrition-related anemia. What is anemia? That is the people associated when they say you have anemia. It's related to the blood oxygen carrying capacity of the red cells. So if there is a level that you even as somebody who is not pregnant, you're supposed to have, so that your normal body functioning will go ahead, without which you are affected. Talk less of if you have to have support somebody who is solely and dependent on you during pregnancy. So, and there is also another factor related to that red cells, which helps in blood clotting. So if you are anemic, it also affects that potential for you to be able to arrest bleeding in the form of clotting. Other indirect causes include other disease conditions, heart disease, diabetes, HIV, AIDS, and other infections, but also malnutrition. Our nutritional level helps us to be able to fight infections, without which we are vulnerable to most infections. Now, to put it into context why most people are dying, it has been observed that there are 3 delays that usually occur, and these are in phases. The first phase is the delay in you deciding to seek care. If you do not take the right decision at the right time, it has impacts, and that can lead to death. Key among which is, for instance, during pregnancy, there are what we call signs of complications of a pregnancy. If you fail to recognize that early, then likely you may not take the decision to go and seek for health care. And failure to also recognize that what you have is severe, because they will always be telling you pregnancy itself is a sickness. Okay, so if you have certain signs which are severe and you need to go and seek for care, but you yourself don't see it as severe, it becomes a problem. But also there is cost consideration. If I have to go to the health facility, I need to pay for A, B, C. Do I have the money? then you have to think twice. Or if I have to go, I need to take transport. What's the cost? So that's also considered. Okay, on the part of our healthcare service providers, if you also have negative experience, particularly with the health system, you think twice, before you go to such a facility to seek for services. But again, transportation. Okay, there's great improvement in terms of our referral system, but again, there are hard to reach areas. Okay, at certain times of the year, you need to go to a health facility, but transportation becomes a problem. So all of this delays the decision as to go and seek care. Delay in reaching the care itself. Now, the time that you need to take to be able to reach a facility, to be able to have the care, if that is long, then it becomes problematic. Thank God there's a policy in this country that within a radius of 5 kilometers, we should have at least a service delivery point. So it's not a major problem in this country. But yet, there are other places we still have this problem. Okay, conditions of the roads. You have to go to a facility, but the only route to that particular facility, the road network is bumpy and it's difficult to access. Then it becomes problematic. Lack of available transport. Okay, nowadays we even have what we call community ambulances. We are supposed to help emergency situations reach health facilities. But at times you go there, the ambulance is stationed there, but they say there's no fuel. So it becomes problematic. So for you to reach the next level of care, even becomes a problem. Another delay is now you have actually reached the health facility. But the care that you are supposed to have, the appropriate care you are supposed to have, becomes problematic. Okay, this has to do with the uncaring nature of providers. Of recent, we saw on social media current happenings that somebody, because of their attitude, of recent I learned the individual is even sent on suspension. Shortages of supplies. You need certain things to care for you, but they are not there. And again, non-availability of the health personnel. There's what is known as essential obstetric care. There are people who are supposed to provide this. Midwives, one of just here is one of them. But we also need specialists to do certain services. For instance, cesarean section. We need obstetric gynecologists to be able to do this, where the woman cannot deliver by herself. You quickly get this individual to a theater and operate on the woman so that both the child and the woman will be safe. So where you don't have such, you are at the health facility, but the person who is supposed to do that is not readily available, becomes problematic. Poor skills of service providers. Thank God there's a lot of interventions by development partners to train more and more of our healthcare delivery personnel to be able to deliver better services. Before, we used to have what we call traditional birth attendants in our communities, who are also trained to do deliveries. But we have seen a lot of disadvantages associated to that. So now we want all our deliveries to be done at health facilities. So with that, we hope so. That's why we can see a trend in the reduction of our maternal deaths. Now, life-threatening delays can happen at any time, particularly at the community level. Okay, but it can also occur on the way to seek care, and even where we are at the service delivery point. Okay, so therefore, for us to be able to at least reduce maternal deaths, we must plan and take actions which are helpful and which are mandatory at every given point. This can be, probably that's not his topic, but for an antenatal woman, what we call bad preparedness. If you are pregnant, you should be ready. At a certain stage, when you go for booking, giving services, they will tell you this and this must be prepared so that by the time you go into labor, these are readily available, depending on the risk. Okay? But also what we call women-friendly care. that can enhance acceptability. Why is it that everyone is now going to Bundum Maternal Hospital? Because they believe that that's where they have best of care. Everyone is rushing there. So women-friendly care and acceptability is also considered. Let's look at some of the risk factors. Yes, what we do that we consider as culture, particularly some of the harmful traditional practices, early marriage, for instance. There are some health consequences studies, for instance, particularly on physical health. And this is related to the overall development of the girl child, for instance. Okay? The girl child is still growing. If you get her into marriage, psychological effect can lead to problems with the normal growth cells of the child, because they still continue to grow. But also because they are not fully grown, they may have complications which are related to preeclampsia, yeah, and also prolonged or obstructed labor, because still physiologically they are developing. And this can lead to bleeding as a result of all the complications which are related to obstructed labor. And in worse instances, we may have the baby born but without life, lifeless babies. Psychological factors can also affect them, particularly when they marry so early. This can lead to depression, which has a lot of health consequences on the mother. And in some instances, divorce, particularly when there is loveless marriages. Okay? But the consequences of this can also be, if they have obstructed labor, there is what is known as viscovaginal or rectovaginal fistulas. A woman who has obstructed labor because the birth canal cannot allow for the baby to pass, and there is pressure from the uterus. Now the head of the child can be rubbing against the uterus, and in some instances there could be a hole between the bladder, leading to leaking of urine, and or from the rectum, leading to leaking of feces into the vagina. And that alone has a lot of psychological effect on the woman. Again, let's look at what is happening in terms of early marriages. Now, there is a data that was collected by UNICEF and other partners, looking at the practice of early marriage within sub-Saharan Africa and other parts of the world. It is realized that, yes, sub-Saharan Africa has around 1990, okay? And then now in 2016, 2008 and 2016, we see that the number of people who are marrying before age 15 is high, but there is some efforts to reduce this because it has effects on health. Particularly for the Gambia, we have seen, okay, around 1990 and 2015, a drastic reduction in the number of marriages from those who are less than 15 years, about almost 48%. But again, we see around our neighboring countries who sometimes come for health services in our country. For instance, Guinea-Bissau. Yes, they've made great strides, but still the numbers are high. Compared to the rest of West Africa, we may have seen some reduction. And this could be related to policies which are related to free education for the girl child, which could have contributed. Before the girl child goes up to senior secondary school, they may turn at least 18 years. Now, there are other factors which can lead to maternal deaths. Inadequate health and nutrition services, particularly our points of deliveries. If they are not enough, or we have less skilled workers to attend to the women, this can also lead to maternal deaths. Or we already mentioned this unpleasant interactions or of providers. Unsympathetic or uncaring experience of women from healthcare providers can also prevent them going to those facilities for service. But again, we mentioned about the delays. Economically, if women are not empowered, they cannot take decisions. For instance, if I have to go to the health facility, I have to wait for my husband to provide the needed finances to be able to go and visit the health facility. If he doesn't have it, then I can't go. But if they are empowered, that can help them. Gender discrimination, okay? Yeah. Most of the times, we have preference for the male child because we believe that they help in the continuity of the lineage of the family. The girl child is going somewhere else to start up and continue somebody's own family. Now, another major risk factor is these unsafe abortions we spoke about, particularly for adolescents. Okay? And this usually ends up having consequences on them. One study actually reported that adolescents, 1 in 10 of them, the abortions that are carried out are done by these adolescents between the ages of 15 and 19. And as a result of this, the unsafe abortion practices, it's as a result of lack of access to those services. And in some instances, because it is illegal to do abortion, so the services are not readily available in our service sectors. Self-induced methods that they take all things, concoctions, and in some instances, all things that you cannot imagine that they think will trigger the abortions to start. And in some instances, there are people who are doing it underground, but they are unskilled. They do it for them, and then these have a lot of complications which can lead to death. And even whereas it is done, there are delays in seeking care procedures. If they do the illegal abortions, and by the time they go to the health sector to seek for services, is always also delayed. The most important part, that what can be done, what are the interventions that actually have been proven to actually reduce maternal deaths. The major complications that actually cause maternal deaths may present initially in the form of mild forms, progressing gradually to become severe as forms of complications. So some of the interventions that can be done to stop this progression from mild forms of complications to severe forms include, first, because most people, particularly for adolescents, they practice unwanted pregnancy. They practice unwanted abortions. The first thing is to prevent those unwanted pregnancies in the first place. Second is to prevent diseases that can actually complicate pregnancies. We should be able to detect these conditions early, treat them by recognizing the signs that actually are related to the complications. And we can also treat complications when they are mild before they become severe. And this is usually in a package called the essential obstetric care services that can take care of the complications. Now, how do we prevent the unwanted pregnancies? We should improve. We are not saying that they should be promiscuous before marriage, but if they are actually sexually active now, they are doing sexual activities. The best to prevent those pregnancies to have them access to the contraception so that they don't get pregnant. Okay? But we should be very careful here because contraceptions also have their side effects. So informed choice and effective use of those contraceptions before we offer them, we should give them that counseling. We should also try, there are others who have already started using contraceptions, but when they go to health facilities, they don't have access. Okay, so how do we meet the needs of such people? Should also be considered. Okay, we should also prevent unwanted pregnancies to reduce the effect of unwanted fertility. There are some women, okay, yes, they want to do unwanted pregnancies termination of unwanted pregnancies at a certain age of their life, probably in their teens. And in that effort, you may have complications that can now prevent you in the near future that you want to have a baby but you cannot have. So it is important that we also help them do that. Now, how do we now prevent and be able to treat diseases or complications early? We can do this through what we call prenatal care. This is why we say the moment you realize you are pregnant, before 12 weeks, go and register. It's a tradition that people want to hide their pregnancy early. But it is good that you go and register early so that you get all the investigations and the care that you require if in case there are potential risks that you may face in the pregnancy that can be identified early and you can be treated. We should also monitor and treat some of the conditions. For instance, we mentioned some underlying conditions that can complicate pregnancies. Hypertension, diabetes, and other disease conditions. If we are able to do that, we should be able to monitor and look at it. We should also give pregnant women and their families some information which is very appropriate in relation to their diet, okay, because we have realized there are some conditions which are diet related. How do we also help them so that we can prevent those conditions, including anemia and other nutrition related problems. But behaviors of individuals, particularly family members and the pregnant women themselves, they need support so that if they are supposed to go for clinical services, somebody is there to encourage them to be able to go and receive the services. Proper health seeking behaviors. Okay? Prenatal care may also be very effective in detecting and also treating two conditions, particularly anemia and hypertension. And there are some benefits to that care, okay, if we use particularly for the infant's health. Okay? A lot of our women go through the process of labor, delivery. I don't know if they give birth, and before the child is even 28 days, what we call neonatal mortality, the child dies. You go through all the pains of pregnancy and childbirth, give birth to the child, and the child eventually dies. You can prevent that through simple immunization. Okay? And there are some who will be born with some complications from diseases. For instance, he's going to talk about that. One of the diseases is syphilis. We do that screening so that if you are detected, you can be treated and you can also prevent the transmission of that infection to your unborn child. If not, the child will have the disease in utero before born, and the child can have complications thereafter, which can also cause death of the child. Now, it's also important that we realize that every pregnancy is a risk. Okay, there are some pregnancies which are more at risk than others. But some will say, okay, yes, we've already indicated that those who get pregnant before they are 15 are at increased risk. But that doesn't mean that, yes, they are the only ones at risk. Okay? Everyone is at risk. Or high parity, if you have a lot of pregnancies, right? That can also weaken the uterus, and it may be difficult to give birth, and in instances you may be assisted, but if where that does not come at the right time, the chances are that you can die. So it's good that we also look at all of this. So any woman, regardless of their age or parity or whatever, we should see every pregnancy as a risk, and that there could be complications at any time. So we must be ready for it. That's why it's important we plan and take actions. Okay? Anemia, which we mentioned, we should be able to detect it early. That's why when you book at the early stage, they take your blood sample to determine your hemoglobin level. If it is low, you will be advised, but also you are given supplements that can help improve your hemoglobin level. But the long-term strategies should be to look at the population level, where we increase production and consumption of iron-rich food. And that can be done through what we call fortification. A lot of our food are now fortified with iron, so that as we are consuming it, we are also able to improve our iron content. Okay? We can also reduce workload. This is very important. At certain stages of the woman's pregnancy, we should be able to reduce the workload, because they need the energy and the food that they are consuming that will help, okay, improve their nutritional status, not only for them but also for the child. It's important that we do that, okay? And we should also counsel family members to understand this. If we don't, they will say, for instance, if you are alone, you don't have anyone to support you. At a certain stage of your pregnancy, you need support so that the workload can be reduced to help you out. Again, we mentioned about this disease condition, hypertension, right? How do we now take care of it? It's a life-threatening one. We should be able to recognize this early and be able to provide and predict preventive measures so that the woman doesn't go into what we call preeclampsia or eclampsia that can be life-threatening both to the mother and the unborn child. So we can do this by regularly monitoring our blood pressure so that it is under control. Okay. Other disease conditions too, yeah, we can help prevent infections, and particularly reproductive tract infections that Mr. Jabi will be talking about. Most of them, fortunately, are curable, although there is no immunity, yeah, but they are curable. When it is recognized, you can be treated. So that there are those that are only treatable and controlled, but there are those which are specifically curable. And for the newborn too, we can also protect them, giving them prophylaxis. For obstructed labor, yes, that's where their domain comes into play. We should ensure that we have skilled labor and what we actually require to also deliver the services, necessary supplies. And where we cannot handle at a certain stage, there should be a referral system and a protocol and a network that should be able to deliver referral services, and also getting a feedback system as to those we have actually referred. Okay, for you and I who are in the teaching profession, what should we do? What can we do? Okay, so it is important that we do our part, doing the education on reproductive health, especially for teenagers, on the risks of early marriage and unwanted pregnancies. As teachers, we can do this. Our pupils, particularly if we engage them, talk to them about what are the risks of early marriages. Nowadays, with this backway syndrome, every one of them wants to get married. And sooner or later, when the knot is tied, this one comes to visit. By the time you realize there's a pregnancy. So we should be able to talk to them to understand what are the risks related to early marriages and unwanted pregnancies. We should also encourage early health-seeking behavior, particularly among, we live in every corner of this country. Schools are all over. Yeah, as teachers, we are agents of change. We inspire the young generation, but also we are within communities. We live with them. We should be able to communicate with them to change their behaviors, particularly good health-seeking behavior. When you realize that, you have abnormalities that you have, please go and see. Particularly for antenatal women, when they see what we call danger signs. There are signs that if they see, they are life-threatening. They should not wait. They should, as quickly as possible, report to the nearest health facility. Importantly, we should provide counseling. I know we have in our curriculum what we call guidance and counseling, but counseling about reproductive health, particularly sensitive reproductive health issues, including risky behaviors such as self-induced abortions. When this girl child notices she has an unwanted pregnancy, they may be tempted to go into doing these abortions. Most importantly, because we have seen some diet-related complications which lead to maternal deaths, we can talk about balanced diets and how nutrition can help in preventing some of the complications which are related to maternal deaths. Okay, I've asked this rhetorical question. Should someone die while bringing new life? It's important that all of us, myself, him, and all of you, act now. We have seen a reduction in the number of maternal deaths, but we can do better because other countries have actually achieved it. Thank you so much for your attention.